10 by 90 gap. 10 by 90 gap is that 90% of healthcare resources are utilized for 10% of diseases which affect high-income countries, while 90% of diseases which are mainly in the low and middle income country, only 10% of healthcare resources are there. So there is not commensurate investment for the many of diseases, and these are the neglected tropical diseases. This reflects the healthcare inequity, this reflects the weakness of healthcare system, this reflects the lower priority. Fortunately, globally now, NTDs are being recognized as a major challenge, and we really hope that in the time ahead, they will be tackled well. So they would not be neglected tropical diseases anymore. Rather, they would not be diseases anymore. And that's what the kind of future we are looking for. Because these are the different diseases, so each of the disease has a different clinical symptoms. Of course, in the snake bite, it depends upon which kind of snake has bitten an individual. So majority of snakes are non-poisonous, but there are two types of poisonous snakes, which are neurotoxic and hemolytic. So symptoms could depend upon the kind of disease which individual is affected. Similarly, if we talk about scabies, scabies is a condition in which people develop itching, and some of the hair follicles have this scabies pathogen which is there. So itching, difficulty in sleeping, etc. There. Leprosy is widely known disease in which the terminal endings of the fingers and toes are damaged and nerve endings are damaged. So it depends definitely on different symptoms. Lymphatic filariasis, we already know that a pathogen is there in the body. It might result in something called hathi paw or elephantiasis. This is a condition which could be severe and which can result in disability. So essentially, what we need to remember and that there are a wide range of diseases. There is limited awareness about these diseases. These are preventable, and because these are preventable, but these are not prevented because there is not sufficient programmatic attention. Because the primary healthcare providers are not aware about the healthcare symptoms, the symptoms of the diseases. Because the general public is usually not aware about these conditions, and they do not seek care in a timely manner. And so all of these disconnects are there, which may vary from one disease to another disease. As an example, with the sustained effort now, India is very close to eliminate Kala-Azar, and the efforts are ongoing to eliminate lymphatic filariasis. Now, lymphatic filariasis is such a deadly disease. It can cause elephantiasis or hathi paw. But the disease can be prevented by regular consumption, annual consumption of mass drug administration, DEC tablets, and with other combinations. So if an individual take a certain amount of tablets as per their body weight once in a year, and the entire population is covered in that way, the disease can be eliminated. That's how India is making progress in this direction. So the key point to remember is that these are innocuous diseases. The pathogens exist, but if we have a healthcare intervention, if citizen and government work together and some of those interventions are implemented, the preventable burden of those diseases can be reduced. And that is why we should work on these. And I also want to flag that cost of eliminating these diseases is far lower than the burden of these diseases and the long-term economic impact of those diseases. So there is every single argument why these neglected tropical diseases should be given priority, why every effort should be made to prevent the preventable burden of these diseases. We know that during the COVID-19 pandemic, due to various restrictions, lockdown, all essential health services had got a hit. So all of these are reminder that neglected tropical diseases, though they are affecting a certain part of the world, but the entire world need to work together. The global research community need to invest to develop drugs and proven intervention. There is a need for more research on vaccines against neglected tropical diseases. The deforestation and climate change has a major impact on a disease spread. We know that every time a forest is cut, the pathogens which are living in the forest and not were in the contact of human beings comes in the touch of human beings, it increases the risk of emergence of new diseases. Similarly, once or as and when there is a rise in the temperature, the vectors, the species, for example, mosquito, which carry a certain pathogen, if there is a rise in the temperature, the vectors and pathogen can survive in additional settings in which they were not able to survive earlier, which essentially means that the rise in the global temperature means the spread of pathogens in additional areas. So putting these two things together, deforestation and climate change, essentially means pathogen will come, the pathogens who were hitherto hidden in the forest or pathogens who were not reaching in a certain area would reach additional areas. And this would result in further spread of those diseases. This would mean that additional populations are at risk, which they were not earlier. And so we should not assume that climate change has no impact on any disease. Rather, climate change, deforestation are being considered factors which will result in increase in the outbreaks, epidemics, and pandemics. And this is applicable for all the diseases, and this is also applicable for neglected tropical diseases. Last year only have seen that monkeypox, which was known only in 11 countries in Africa, now has been reported from 100 plus countries across the world. And this partly is the outcome of the human intervention or human interference with the forest and climate and rising global temperature. Health of humans, animals, and environment need to be protected. And that's the only way we can fight NTDs and other diseases.